is Marielna Forapuda, and today I'm going to be performing the Ballard score to a newborn baby. So basically, a Ballard score is a technique used to determine the gestational age of a newborn. Also helps us enable to identify if the infant is a premature, mature, and post-mature newborn. Now, this assigns a score to various criteria, and the sum of which is extrapolated as the gestational age of the fetus. This also allows the healthcare providers to estimate the age ranging from 20 to 44 weeks of gestation. Take note that the score may range from a -1 to a score of 5. There are two main components of the Ballard score. These are the neuromuscular assessment and the physical maturity assessment. Neuromuscular assessment depends upon the muscle tone, active or passive, and deflection and extension. Meanwhile, for the physical maturity assessment, this relies on the anatomical changes in the skin, eyes, ears, genitalia, lanugo, plantar surface creases, and the breast tissues. In this assessment, we are going to need our forms, our papers to take notes, our pen, and some clean gloves for PPE. So here we are in the baby's crib. First thing that we're going to do is we're going to check for the baby's identity. By doing so, we are going to look for the baby's identity tag. The identity tag is placed in the wrist or in the ankle of the baby. So slowly open and unwrap the baby from the blanket. So here we are, we can see the tag on the wrist. So the baby's name is Felicia May Santos, born on November 9, 2021 at 9 a.m. So this means that we have the right patient. Next is to provide privacy of the patient. Next, perform proper hand hygiene. I have here with me alcohol, but you can also use your soap and water. Then, apply your clean gloves. Now, neuromuscular maturity has 6 different criteria. These are the posture, square window, arm recoil, popliteal angle, scarf sign, and heel to ear. The first thing that we're going to assess is the posture of the baby. So we have the baby here. Now, the natural position of a mature baby should be flexed because the extensive extremities is an indication of prematurity. So now we are going to check the posture of the baby, if it is extensive or it is flexed. Next we have square window. This assesses the flexibility of the baby's wrist, which are right over here, and that the wrist of a mature baby should be bended up to the baby's arm all the way, because if not, it is another indication of prematurity in the newborn. Third we have is the arm recoil. This assesses the flexor tone of the bicep muscles of the infant, to which if a mature baby's arm is pulled or extended, it should wrinkle back to its original flexed arm position. And if it does not wrinkle, it is an indicative of prematurity. Another one we have is the popliteal angle. This assesses the maturation of the passive flexor pressure tone about the knee joints, which is over here, by testing for resistance to extension of the lower extremities. Going to bend it a little bit, support the baby's legs, and going to meet the resistance right here. Okay, next we have is the scarf sign. This is to assess the elbow's passive tone of the flexors when doing the scarf signs of the mature baby. Then, the healthcare provider conducting the assessment should meet resistance. If not, it is an indication of prematurity. So, we should need the resistance. And lastly, we have heel to ear. This assesses the hip flexibility of the infants. In doing so, in bending the knee of the baby just like the scarf sign, the healthcare provider should meet the resistance. And if I can take this all the way up to the ear, then that is an indication of prematurity. And after doing the assessment, the information or data gathered as well as the results should be written down to the Ballard scoring sheet, which we have over here. The next assessment we have is the physical maturity assessment. And just like the neuromuscular maturity, it too contains 6 different criteria. These are the skin, lanugo, plantar surface, breast tissue, eyes and ears, and lastly, the genitalia. In the physical maturity assessment, the first thing that we're going to be looking for is the skin texture of the baby. Now, if the baby is premature, their skin will be sticky and transparent. Then, as they mature, it will thicken. And if the baby becomes post-mature, then the skin will become leathery and wrinkled. Next thing we're going to check is the lanugo of the baby. So, when we say lanugo, these are soft, feathery hairs that can grow all over the baby's body. Now, for mature baby, they will have very little lanugo and they also appear mostly bald. As for premature babies, they will have abundant lanugo in their bodies, and as for very premature babies, they will have no lanugo seen at all. So now I'm going to observe baby Felicia's body, if she has a lot of lanugos or no lanugos at all. In assessing the plantar surface of the baby, which can be found at the bottom of the baby's foot, we can tell if it is a mature baby if we can see any creases across the entire sole of the baby's foot, and we can tell if it is a premature baby if the baby's sole of the foot is smooth and soft and there's no signs of creases at all. So now we're going to check for the breast tissue of the infant. For a baby that is premature, the areola will not be perceptible. Sure, the baby will have full areola, which is about 5 to 10 millimeters in size. So now I'm going to be checking for the baby's breast tissue area. Okay. Now, in assessing the eyes and the ears of the infant, as for the eyes, if the baby is truly or really is premature, those eyelids may kind of fuse or shut. So I'm going to check closely the baby's eyes. Okay. Then, for a baby who is mature, they should be able to open their eyes easily with no problem with the pinna. Okay. Appears to be that the baby is mature. Then, for the ears, if we were to take their ear cartilage and then bend it forward, that's a mature baby that is able to recoil. So recoil is like bending in the inner part of the ears. Take note that recoil should be very quickly or quick. But for a premature infant, if we bend it forward like this, it will stay in the same spot or area. And now we made it to our final criteria, which is the assessment of the genitalia. For males, if the baby is premature, his scrotum will be flat and smooth. As for a mature baby boy, he will have an ependulous testicles along with a presence of ruga, which are little wrinkles on his testicles. So now I'm going to check. But given that we have a female client or infant over here, as for females, if she is a premature baby, she will have a prominent clitoris and flat labia. And when the time comes that she matures, her labia majora will cover the labia minora as well as her clitoris. So now we're going to observe. Okay. And that concludes my video demonstration regarding the Ballard scoring in a newborn assessment, to which it is used to determine the gestational age of an infant. Hope you guys have learned a lot from this session, and I hope to see you again really soon. Bye!